Type 2 diabetes is one of the most common ailments in our society. More than 1 in every 10 adults has type 2 diabetes. Almost 30% of people over 65 have diabetes, and it's even becoming common in children. If you are diagnosed with diabetes, your doctor will tell you that you will need to take insulin for the rest of your life. Your doctor is wrong. My guest today is Dr. Paul Marik, the co-founder, chairman, and chief scientific officer of the Frontline COVID Critical Care Alliance, based in Washington, D.C. Dr. Marik is an accomplished physician with expertise in a diverse set of medical fields, with specific training in internal medicine, critical care, neurocritical care, pharmacology, anesthesia, nutrition, and tropical medicine and hygiene. Dr. Marik was diagnosed with type 2 diabetes in his early 40s and was put on medication to control his blood sugar, until he discovered what medical colleges are not telling doctors and what the pharmaceutical industry doesn't want you to know. Recently, Paul changed his diet and eating habits. Today, he is on 0 medications, and his blood sugar levels are returning to normal at the age of 64, after more than 20 years as a diabetic. Now, I want to talk now about what you did specifically in your diet that has fixed this. Please tell us what changes you made and what was roughly the time period that it took to see the effects.
There were 2 things that were coupled. The first thing was this time-based feeding. So what I was doing, and it's standard amongst Western people, is eating all the time, snacking all the time. We told them multiple small meals a day. And actually, that's completely and totally unphysiologic. Early man would eat 1 meal a day. And so eating all the time, what it does is it stimulates insulin release all the time. It causes your blood sugar to spike all the time. It causes insulin resistance. So what I did was time-restricted eating. What I did initially was eat between 12 noon and 4 or 5 in the afternoon, maybe 2 meals a day. And then the rest of the time, not eat. Obviously, you can still drink. You want to take fluids. Coffee is fine. So the first thing I did was time-restricted eating. And the other thing is not to eat just before you go to bed. It's probably the worst thing you could do. Numerous health benefits of time-based feeding or time-restricted in terms of glucose control, metabolic control, in terms of release of. So what's important to emphasize is this is not starvation. There's a big distinction between somebody starving and doing time-restricted eating. They already have the opposite metabolic effects. So what happens if you starve is your basal metabolic rate goes down to compensate. And therefore, if you eat less, your basal metabolic rate goes down, so you consume more calories. And so this is the problem with this eat less, exercise more paradigm. Whereas with time-based feeding, the opposite happens. Your basal metabolic rate stays the same or goes up. And growth hormone, which goes down with starvation, actually goes up with intermittent fasting. So it's very different. And so this is not a starvation diet. It's not a severe caloric restriction diet. I'm just restricting the time that I eat to what the body was designed for, is you have periods of replenishment and eating and periods of fasting. One of the important things is when you fast is you activate a cellular process called autophagy, which is very important cleans out basically, it's the cell mechanism for dealing with cell garbage, basically. It's very important for the brain. So, when we sleep, the neurons undergo autophagy. But if you eat before you go to sleep, it switches that process off. So it's very important you don't eat for about 4 hours before you go to sleep. So the first thing I did was this time-restricted eating, and I've now got it down to where I eat 1 meal a day. It sounds severe, but actually I'm not hungry. It's a truly astonishing thing, because what happens is you break the cycle of insulin resistance causes leptin resistance. So I used to eat all the time because I was actually hungry. Whereas now I eat 1 meal a day and I'm not hungry. It's a truly astonishing phenomenon, which is based on physiology. So I'm down to 1 meal a day. And I've coupled that with a low carbohydrate diet because really, people think you need carbohydrates. The bottom line is there's no human requirement for carbohydrates. You can survive on zero carbohydrates. And, diabetic experts will attest to this. Although the brain does need some glucose to function, the body can actually make glucose from proteins and from other backbones. So you actually don't need carbohydrates. I take a small amount of carbohydrates. I think what cured my diabetes was the combination of time-based feeding and changing my diet to no processed food, none. And I eat a diet which is low in carbohydrate. I used to think that bacon and eggs and saturated fats were bad, but that's part of the myth. Actually, they're healthy. And
Yes,
saturated fats actually is the only way to get your HDL up. So, we were completely obsessed by total cholesterol. It's a complete obsession. In fact, the best simple cardiac predictor is the relationship between triglycerides and HDL, that ratio. So what pushes up triglycerides is carbohydrates, and what pushes down HDL is carbohydrates. So you want to work on that relationship. But once you switch your diet, you'll find triglycerides go down and your HDL goes up, and it significantly reduces your risk of cardiac events. It's very, very important that cholesterol is bad. So that's actually completely false. There's a very high concentration of cholesterol in the brain. It's part of the cell membrane. And actually, one of the side effects of statins, which reduces cholesterol, is impaired cognition. That's what it does. It impairs your thought process, your cognition, accelerates dementia, interferes with memory. So cholesterol is actually good for you. And this idea that eating cholesterol drives up cholesterol is nonsense, because the body makes cholesterol and it makes enough cholesterol for what it needs. And the brain is a really important source of cholesterol. And if you try and lower cholesterol by using ridiculous pharmacological drugs, one of the big side effects actually of statins is neurological problems, confusion, dementia, and also statins cause diabetes, increase your risk of diabetes.
Yes.
Isn't it astonishing?
So I'd like to just weigh in with what Dr. Marik has said, because I've been practicing intermittent fasting for years, and he's absolutely right. A lot of people are afraid, well, if I start doing this, I'm going to be hungry all the time. No, you won't. Your body will adapt very quickly. In fact, most people, if you're very consistent, most people will adapt to this within 3 or 4 days. And you will find that during that period of fasting, you're not hungry. Now, I'm not quite at where Dr. Marik is. I tend to eat in a 6-hour window. I'm not down to that 1 meal per day, but I know lots of people who do exactly what he's doing. The important thing is that you've got to have that long period of fasting. It has to be in excess of 12 hours, because it takes about 12 hours for your body to burn off all the sugar and to start running on ketones from your fats, which are actually a better fuel source. You'll find your brain will wake up. A lot of the brain fog will go away. You'll be able to think more clearly. You'll have more energy. And no, you won't be hungry. Bacon and eggs, I eat a lot of them. Dr. Marik's absolutely right. These are healthy foods. The proteins and fats in them are fantastic for the human body. But now, all I wanted to do there was just add to what you had said, Paul, because you started talking about cholesterol. And that's another one that the pharmaceutical industry is pushing on people, this lie that cholesterol is bad. It's not bad. The high inflammatories that often go with it, as you were talking about, is very bad, but the cholesterol itself is not.